I'm Dr. Masooma Merchant. I'm a gynecologist, obstetrician and a laparoscopic surgeon. I practice in South Bombay. I'm attached to Masooma Hospital and Noor Hospital. My private clinic goes by the name of Mom Clinic, situated in Nagpada in South Bombay. Today I'll be speaking about a very common topic which we see day in and day out, that is vaginal discharges. First of all, let's see what a normal discharge is. So, it is normal to have a vaginal discharge which is slightly watery, whitish, non-irritating, non-odorous, that is no smell, and the pH is around less than 4.5. Usually a normal vaginal pH would be something around 3.5 to 4.5. And the vagina also contains certain bacteria, that is the lactobacilli, which is considered as a normal vaginal flora that helps to keep the vagina safe from other infections. Now a very routine complaint that comes in is leucorrhea. Now what is leucorrhea? Leucorrhea is basically an excess of the normal vaginal discharge. So leucorrhea should have the following conditions. One is that there is a lot of vaginal discharge where a patient tends to wear pads or tampons to control that, as well as when it stains the undergarments, it causes a brownish hard discharge over the time. Leucorrhea is non-odorous, non-irritating, non-foul smelling. Now conditions in which we find leucorrhea, it could be a physiological conditions, it could be related to the cervix or to the vagina. Now the physiological conditions in which normally leucorrhea is seen is, one is at the time of puberty, when the girl in her first year of just starting her menses, that is during the menarche, because of the sudden increase in the estrogen levels at that time, leucorrhea is a complaint that comes in. Another physiological condition in which we get leucorrhea is during the ovulation period. Now ovulation period is almost towards mid-cycle, that would be around the 14th day of your period cycle. This is again because of the high peak of estrogen that is happening during ovulation when your egg ruptures. Another reason for a physiological leucorrhea would be in times of pregnancy. Pregnancy is also a state of high estrogens, hence you also have leucorrhea at that time. And also during sexual excitements. During sexual excitement, there is a gland called as the Bartholin gland, which causes an excess of white discharge, and this is actually to help during the intercourse. Now conditions related to the cervix. If there is a cervical polyp, or in case there is cervical erosions or cervicitis, which is cervical infections, these are also conditions that cause leucorrhea. Vaginal related conditions will be in the case of pelvic congestions, which can cause excess of discharges, as well as in the case of retroverted uteruses, where you have a uterus which is actually bent towards the backwards. These are conditions where you can have this excessive of normal vaginal discharge. Now what is the treatment for the leucorrhea? Usually we ask the patient to improve their general hygiene, general health conditions that could solve the condition. As well as in the case of excessive discharge where it is irritant to the patient, as in they always have that wetness feeling, in that we have to tackle the high estrogen levels. So in that case we give things like EPO, which is evening primrose oil, or even pills which contain less estrogen amounts. In the case of pathology, like in case there is a cervical polyp, a polyp excision would be required, and in the case of cervical erosions, we might have to do a cauterization where you burn off the erosions around the cervix, and on top of it a new layer of the cervix would be formed, which is a healthy which will be a healthy layer. Now this is about the normal vaginal discharge. Most of the complaints that come in is of an irritant, itching, or a foul smelling kind of discharge. So we'll just go through what are the different type of abnormal vaginal discharges. Now in the type of abnormal vaginal discharge, we have something called as Trichomonas vaginalis, that is caused by a parasitic protozoa. It causes this greenish, yellowish, frothy type of a discharge. There is intense itching over here, and the pH, if the pH is checked of that discharge, it is usually more than 5. And the treatment for this would be to give metronidazole as the antibiotic, either local application or oral, depending on the severity. Another very common abnormal vaginal discharge would be candidiasis. This is a fungal infection, very common, the most common vaginal infection that is seen. In this you get this whitish, curdy, thick kind of a discharge. But over here if the pH is checked, the pH is still less than 4.5. There is there is itching, but not a very severe type in the case of candidiasis. The treatment for candidiasis would be antifungals like fluconazole or itraconazole, and even local applications would work. Another type of vaginal infection will be bacterial vaginosis. This is caused by a bacteria which are the Coccobacilli. Over here you again get this greenish kind of discharge. It's a greenish grayish kind of discharge, and it's not very thick, it's more of a watery type of a discharge. Here the pH is again more than 5, and there is no itching in this condition, so it's just the discharge which is the complaint. The treatment over here again would be metronidazole oral or local applications. Another type of a discharge will be the chlamydial infections. Again over here you have this whitish thin kind of a discharge, not a very thick discharge. There is no itching again, and the pH is again over here normal, and the treatment over here would be azithromycin. Now, to understand what kind of discharge the patient is having, it is necessary to do a vaginal examination. Sometimes if required, we check out the pH of that of the fluid that is there, and if any doubt, we could either do a pap smear. A pap smear is actually a test of the cervix, that is the mouth of the uterus, in which you can come to know the infection or any other hormonal causes also of the cervix that could be causing these discharges. Or we could do a high vaginal swab and send it for a routine and a culture with the exact organism causing the infection and the exact antibiotic which is required to treat the infection. Would give us a better idea of how we should go ahead with the treatment. So these are the basics of all the possible vaginal infections, the normal as well as the abnormal, and what sort of treatment is required to help the patients. These vaginal infections can only be treated if we actually see them, and then only we can make out the different types of color and the pH, and then give the required treatment. If you want to know anything more about the vaginal infections or any sort of gynec and obs problems, you could get back to me on lybrate.com. Thank you.